Hey everybody, this is Paul from Ortho Eval, and with me I have my friend Marc. Marc has injured his shoulder, okay, but let's get a little history. How long ago did you injure the shoulder before this last episode, which happened 4 days ago?
About 10 years ago.
10 years ago, okay. And you underwent reconstruction, and the shoulder really performed well after that for you, didn't it?
Yes.
A lot of strength, and he does a lot of machining and milling and things like that, lots of lifting, carrying, pushing, and pulling. He was able to do that very well until about 4 days ago. Can you explain to me what happened?
I slipped on the ice when I went to reach for a door, a very icy walkway, and just went down instantaneously and landed on this right elbow.
Kind of like this, like it kind of drove it up?
Right.
Okay.
Yeah.
All right, so not out like that or out to the side, it kind of drove it up there.
Like that.
Did you have any immediate pain when it happened?
Yes.
Where was your pain, in your elbow or your shoulder?
Both.
In both, okay. How was your pain level today?
Not bad at all.
Not bad, okay.
Not bad. The shoulder, the elbow is still a little tender,
Yeah.
but there's not much pain.
All right, okay, so how old are you, about 52, 53?
61.
That's how you buy points, you know, with your patients. So, he's 61. All right, so we took a look at this shoulder a couple days ago. Today we're going to go through a comprehensive evaluation. One thing we need to remember is that there are all kinds of things that can make this arm look like it's not working very well, okay? So the first thing I'm going to do is I'm going to ask him to try to move his shoulder for me, and then I'm going to go into my evaluation. So do you have any tingling down the arm, first of all?
No.
No tingling, okay. And you're able to use your hand down
Yes.
here? And
Yeah.
Okay, pretty good. All right. Now, can you lift your arms like this overhead? And if that one goes all the way, now how much can you give me on this one? Can you do both of them at the same time? Go ahead, lift that one. Go all the way up with that. All the way up. Good. That's as far as this one will go. Well, this is better than 2 days ago. And back down. Notice the hiking of this shoulder, okay? Now can we go out like this? Lift that arm up to the side as far as you can. Will that one go all the way? Good. And this is as far as this one will go. Okay, great. You can rest. Can you reach for your head? How about with this side? Okay, very, very compensated motion. Once he gets it up there, it's not too bad. Okay, now go ahead and let it right down. Okay, and if I lift it up, no problem.
No.
Can you hold it there? All right, look, he can do that, but he's isometrically using his deltoids to do that, okay? And let's let the arm down all the way. Okay, I'm going to lift your arm out to the side. Can you hold that there? Not very good, and he's hiking quite a bit over there. All right, so first thing I want to do is I want to make sure he doesn't have some sort of a neurological issue going on. So I'm going to check his reflexes, and really quick, relax that arm, let it drop, so C7. And I'm getting I'm seeing the tricep contract. Relax. C5. He's not relaxing very well. Relax that arm. There you go, perfect. Okay, got a tiny little bicep contraction there, and I've got some C6 over here, brachioradialis is contracting. We're going to go to this side. Now I'm going to passively bring his arm like that, not a lot of pain there. Okay, C7. C5, right there, and C6. Everything works well. Now, just to save some time, I tested his intrinsics, his OK sign, I checked his wrist extension, wrist flexion, supination, pronation, all of that looked really good, okay? And then can you look over that shoulder and look over this way? No problems with that. Look straight up and back down. None of that reproduces your shoulder pain. So we've kind of ruled out the cervical spine. I don't need to do a Sperling's with him. I'm really not suspicious. I already did the Sperling's with him and we had no problems with it. He has no sensory deficits going down his arm, okay? Now, the first thing I checked with him was that elbow. So relax your arm. I took a look at it, okay? A little bit of bruising here, but not bad. I resisted his triceps and his biceps, supination, pronation. He had really no problems with that. He has full range of motion of the elbow, so I'm not really concerned that he injured that elbow, okay, except for some bruising there. But he did take an axial load to that shoulder. So now what I want to do is try to assess the shoulder a little bit more by doing just a few special tests, but obviously I don't want to kill him because he's obviously in some discomfort when he tries to actively move the arm. So the first thing I'm going to do is I'm just going to check his passive range of motion. I want you to relax. That's not too bad. How about if I take you this way? It's okay.
Yep.
All right, so I'm going to do just an empty can test. I'd like you to hold that arm right there. We're going to stress that supraspinatus a little bit. Can you hold it there? Okay, hold tight. Okay, so one thing you need to remember is that this is a painful weakness. If it was a painless weakness, then you need to be concerned that it's some sort of a nerve injury, like a suprascapular nerve problem or something like that. But he has pain with this, okay? Now, we're going to check his infraspinatus right here. Hold. And he can't resist, and it's painful, okay? Now we're going to do the Hornblower Test. So I want you to hold right there. This is more isolated for the teres minor. Hold tight. He has zero resistance there, and it's painful. So we resisted the supraspinatus, infraspinatus, teres minor. They're all weak, severely weak, and painful. Okay. Now let's check his subscapularis. So we'll do a belly press test. I want you to hold the arm right there. Don't let me pull it away. Good. We're going to do a bear hug. Hold there. Don't let me pull it away. He's nice and strong there. And we're going to do a liftoff test. So we're going to put that arm behind your back like this, and you're going to lift your hand up off of your back. Okay, so lift it right up off the back, and he can do that. And hold it up there now. Don't let me push it in. And he offers me some really good resistance, okay? So, subscapularis seems to be perfectly fine. We're going to check his biceps. Hold right here. Hold tight. And he gives me great resistance, and that looks really good there too. Don't let me turn your hand inward. Again, biceps and supination, and that's okay. Next thing I'm going to do is I'm going to palpate. Okay, so I'm going to follow his clavicle. I'm going to go to his AC joint. Any pain there? Not bad. Okay, and I'm going to come right down here into the bicipital groove.
Oh.
And he's uncomfortable there. And greater tubercle. And he's uncomfortable there. Okay, so kind of a classic rotator cuff tear here, okay? I'm very suspicious he tore his supraspinatus, infraspinatus, and teres minor because of the amount of weakness that he has, and he has pain associated with that. I don't think he has a neurological issue. So what we're going to do is we're going to very slowly try to work on activating his rotator cuff, because I've seen these situations like this where they have such an inflamed rotator cuff that it shuts down and it looks just like a rotator cuff tear. So we can sometimes activate that and decrease inflammation with some non-steroidal anti-inflammatories. And today he actually demonstrates a little bit better active range of motion than he did when he first came in a couple days ago. So I think that we're going to do that for a couple of visits to see if we can activate him a little bit more. At night when you're sleeping, are you having a lot of pain with this? No? And you sleep on it and it's comfortable. Okay, so this may be a large tear. Actually, the larger the tear, the less pain you have at rest. Okay, that's pretty classic also. And they usually feel okay if they put some pressure on it. They just basically put the ball into the socket and it gives them some relief. So we're going to start with some light active range of motion, some light isometrics, some passive range of motion, make sure he doesn't freeze up on us. And then if he's not starting to show some improvement really quickly here, we're going to ask for an MRI of that shoulder to see if he has a tear, and then we kind of go down that route. So thank you so much for watching. If you have any questions or comments, please leave that down in the comment section of this video, and please like our videos, subscribe to our channel, and make sure you check us out at orthoevalpal.com. Thanks.